thank you for the question. I do believe that the PSMA scan will be a game changer as it comes to prostate cancer. I think mainly in the field of recurrent prostate cancer. It's certainly been studied and evaluated also in the diagnostic or the staging realm of prostate cancer, i.e. detection. So there's been a really nice study done called the PSMA study, where they looked at patients who were undergoing staging prior to like a definitive therapy, and the accuracy of PSMA over what we consider conventional imaging, like a bone scan and a CT scan, it was greater than 25% more accurate in the detection of spread of the prostate cancer. Additionally, there were some more equivocal findings with conventional imaging over the PSMA imaging. And where I really think a nice feature of the PSMA study that was published in Lancet just a year ago was that almost a doubling, but for a patient that had a PSMA-based image detected metastasis, the management changed by about twofold, meaning about 30% of the time PSMA led to a change in management compared to 15% of the time when patients had conventional imaging. It was a well-designed study, so that's for detection of spread prior to intervention. But where I really think that PET imaging is going to revolutionize how we manage prostate cancer is in the recurrent setting, where we know that conventional imaging is poor in detecting spread after, curative intent, whether radiation or surgery, and there's a PSA recurrence. And we know from, thousands and thousands of patients that depend on the PSA level, but at very low PSA levels, even less than 1, and sometimes at PSA levels of 0.2, in the postoperative setting, the PSMA PET can detect some metastasis, which the hope is by earlier intervention on those metastases that we actually can impact outcomes of those men for the better, obviously. So I've been heavily involved in the development of a C11 choline PET CT scan for staging and restaging of recurrent prostate cancer. It does require a on-site cyclotron, which is not readily accessible for most physicians and patients around the country. With PSMA, it will be a kit that can be sent to facilities that have our standard PET CT capabilities. The standard PET CT that is done for various malignancies is called FDG. It's a glucose-based PET, but if they have that facility, then the PSMA kit, both the gallium and the PSMA, can be shipped to those centers and provided, more access to patients from around the country. So I'll focus more on the recurrent prostate cancer setting, whether it be surgery or radiation. And I certainly don't think that PSMA PET CT replaces an MRI. Certainly there's some, I think, feasibility of getting MRIs, especially in patients who are failing via PSA of primary radiation therapy, to look at the prostate in more kind of anatomical detail that is obviously more granular, that can be provided by a PSMA PET. Certainly there is some PSMA PET MRI research going about, but that I think an MRI and a PET CT scan provides sort of the whole picture. And I think with PSMA PET certainly can start at very low values of PSA. Currently, we have an ongoing study of starting a PSMA PET scan at a PSA of 0.2 postoperatively. Radiation has various definitions, but certainly I think once a patient meets that definition of radiation failure, then a PET scan is warranted, as well as an MRI. But the performance accuracy of any PET scan and the performance accuracy of even an MRI is truly based on the PSA. So the lower the PSA, the less likely you're to detect metastasis. And as the PSA climbs, there is to be a finding. So I truly think the concept of performing bone scans, performing CT scans for men with low PSAs after prostate cancer surgery is going to go to the wayside, and we are truly focusing our efforts on MRI and PSMA PET CT scans, or occasionally choline scans still, depending on the patient's histopathology and course. And I think ultimately all of our hope is that by that earlier detection of recurrent, or that recurrent disease, or that earlier detection of metastasis, even a concept called oligometastasis, which are few metastases, by earlier intervention, that we truly impact survival and outcomes that are an improvement of what we've seen in the past. We know that, for instance, in the postoperative setting, for men who have a PSA recurrence, by using a PET scan, there can be improved even postoperative radiation outcomes over conventional CT scans that have been historically performed to determine the radiation fields. Well, as I mentioned earlier, I think the even PETs, PET CTs in general, I think have revolutionized how we manage men with recurrent prostate cancer, and perhaps now even with initial staging of a particular high risk prostate cancer. I think that ultimately there's ongoing research being done. I do think that a PSMA PET scan will become sort of our standard imaging as it pertains to recurrent prostate cancer. And the hope is that by, as I mentioned, perhaps the earlier detection and earlier intervention, and definitely getting the PET scan on the right patient at the right time and providing the right therapy will be a game changer. And I think that with the use of PET scans, that's fairly ubiquitous across other cancers in the U.S., it'll be fairly standard for patients to get a PSMA PET scan across the country as it pertains to either recurrent prostate cancer or even progressing metastatic prostate cancer, since PSMA can still be readily expressed in the majority of recurrent prostate cancers.